Hi, everyone. We're maybe a minute or so early, but I thought I'd check in, make sure you can hear me. Um, I'm still learning or experimenting with, there's two things in your upper right-hand corner. One um, talks about um, questions, and one talks about a chat. So I wonder, could somebody send me a chat? And I want to see if it shows up. It's one of the things that didn't work very well the last time we did a webinar. So okay, let's see. Good. I see hands going up. Now, how about if somebody would just send in a question under that one, under that little bar, and we can hear you. Great. So it sounds to me like we're going to be better off um, if we use the question box rather than the chat box. Those of you that are asking how I am, I'm fine. I hope all of you are fine too. So good. I think we'll get started here. Now, let's see. You can see your screen. Start the screen sharing. So the next thing I'd want to know is, now can you see me? Too. People can see you, it says, anyway. Okay, thanks. So I'm going to switch to you should be able to see me and the slide. Is that true? Somebody send that in to me. Hi, this is Christy. Yes, great. Okay. So welcome everyone. And I appreciate your patience, because we had to kind of postpone this from last week because we had a lot of difficulties with people saying that they weren't able to register and get in on this. So I'm glad that you're all here now. We're using a different platform, and I think I'll even be able to see your questions as they come in. So be safe, be well, be strong, be better in the long run. And I'll kind of develop that as we go along here. So let me see here. So let's start out with, first of all, a disclaimer. Just so I'm legal about this, what we won't be talking about is how to cure COVID-19 or any other disease, really. What we will be doing is really talking about mechanisms to make ourselves healthy and make ourselves less vulnerable, and make it so that a virus has a much harder time wreaking any havoc with us. So we know this is a virus. Probably came from an animal, although that still seems to be disputed. But usually that is what happens with these things, is that the virus is in an animal, and then it mutates. So when it mutates, sometimes the mutation doesn't mean much, and sometimes the mutation means now they're able to get their little selves into a human body. And that's where we are today with this current one. And my thing keeps, okay. So I believe, and pretty much what experts are saying, we're still at a pretty early stage. Although here in Northern Michigan, not everybody on the line today is from Northern Michigan, but a lot of you are. In Northern Michigan, things are growing at a very fast rate. And although the numbers are low, per capita, the numbers are quite high. And if you look at a map, even the surrounding counties, we're way faster here. It's growing much faster. So I do believe this is a time for us to buckle down and do the best things that we can to try to protect ourselves. Stick with me here because I'm going to kind of develop why it's important for us, as we move along here. So throughout the world, the biggest way, the most common way that this is spread is through our family, as that's who we have the most contact with. So, so kind of with your family, what if it's just a cold? Well, probably you would get some symptoms and they might seem pretty similar to what COVID-19 is. And you would take some steps, just like you always would if you had a cold. Now, if it starts getting more severe from that, then you really need to isolate yourself from the rest of your family, because the last thing you want to do is get other people in your family ill. And so some people are more vulnerable than others. So if that starts happening, just start hanging around in a separate room more. Keep your distance even from your family. Use a separate bathroom if that's possible, or really kind of sanitize as you leave. If you have a mask, put it on yourself if you're the one or the person that is sick. The mask thing is another controversy, but from what I can tell, surgical masks are good about 80–85% protection. But even a good kind of thick cloth, or the way that they're talking about doing them on the internet these days, it still gives you 70% prevention. So I think it's a good idea at this point. When you eat, keep your distance from other people. Keep the surface that you touch, and just kind of do some common sense things, even though you might seem, oh heck, I've had a cold like this before. Well, it can be different now. We don't hear very much from the CDC, and we should, but Dr. Redfield is the director of the CDC. And what he's saying is this virus is about 3 times as infectious as the flu. About 25% of people will get this and will not have any symptoms at all. But this can be a problem because you don't really know, but it's in that stage where you could be spreading this to someone else. So I say to people, and this is what we say in our office, think about, what if you have it yourself? What do you need to do to protect other people? Think about, if the other people you're being in contact with have it, what do you need to do? And that's where the social distancing is, and wearing gloves and a mask when you go to a grocery store, and all these things that are really foreign to us, but really things that right now, particularly, we should be doing that. And he says there probably will be a second wave in the fall. And he's mostly saying that's because that's what usually happens with any type of virus. That's just a normal thing. Probably wherever you are, COVID is somewhere around you. You may not know it. It may not have hit somebody, but it's probably out there. So this is really the time to take these steps and try to turn into something that fewer of us have any real experience with it, real devastation with ourselves or our family or our neighbors or anyone. There's little or no infection of people that are below 14. And in fact, today they're saying below 18, it's even pretty low. We really don't know why, but kids aren't getting this. And if they are, they're getting it at a really less amount. What we don't know is, can they still be transmitting? That we just don't know enough about. So how do you get it? Pretty much what I think is something that's really useful to know is that you really get this by sustained contact. I'm just going to flip myself on here for a minute. What that means is you need to be in contact with it for about 15 to 30 minutes. So it isn't so much that you might touch something and then anybody you touch is going to get this. But it does make sense to be washing your hands really often. If you're somewhere where, you know, you're opening up doors and contacting things where there have been a lot of people, wash your hands quickly, because even if you made contact with it, one of the things that we also know about this virus is, although it's rough when it gets inside of us, outside, it's pretty wimpy. So it dies pretty easily with contact with alcohol or washing your hands for 20 seconds or so. But we get this by usually getting it on our hands and then getting it on our face. Eyes, nose, and mouth are the ways that we get it in. And so one of the arguments for actually wearing a mask when you go outside or you go to the grocery store is because we're not all that conscious of all the times we touch our face. And so what I've noticed is wearing a mask, you really can't get to your face. And so it really protects you as well as, you know, protecting you in other ways. So I wanted to leave this screen up just so you really get the idea. It takes a little bit of time. It's not like you got touched or you touched and then immediately something happened to you. This virus is in a corona family, and that's a new word for most of us, but it really is something that we know a little bit about. It's just that this strain is different from anything else we've come across before. So we're really totally dependent on our ability of our immune system to respond. This is a new threat, and we're really relying on our body to come through. And most commonly, it likes to go to the lungs. That's its favorite spot. But also remember, 80% or more of people get no or very mild symptoms. So shortness of breath at about day 4 or 5, and then they start to feel better by about 7 or 8. So this is why in natural healthcare, the emphasis is so much on strengthening our immune systems, making it so that we're part of that 80% that gets very mild symptoms if we get it at all. So there's going to be a lot of people that get this and never even know that they did. So that's how you get it. How to not get it. So all the things that you hear on TV, they are true. They really are things that help to slow or stop the spread, keeping your hands clean, keeping your hands away from your face. And so those are things that we really need to do. They don't really make us healthier. They don't make us stronger. What they do is they help stop the spread. And if nothing else, it's an absolute public service to not get this spreading to particularly people that this can really turn into something serious, and that's how we lose lives. And we all want to slow or stop that down as much as we possibly can. So I say, if you think you're healthy, this is not the time to be bragging and thinking you're healthy. If you think you're healthy, then your job is to keep other people healthy. You've got an opportunity to do that. I still see people that don't take this seriously. So I wonder, do they just not know? Or are they just feeling like, it's a flu, that kind of thing. But I can assure you, this is more than what we're used to thinking of as the flu. Hospitals have either already run out of room and equipment, or they will soon. And what that means for all of us is that if something happens to us, if we have a heart attack, if we have a broken leg, if we're in an auto accident, there's not going to be a room and there's not going to be a doctor because they're all busy. They're overwhelmed. And when that happens and there's not enough equipment, then more people die simply because we can't put the proper measures and attention that we would normally because everybody's stretched. So in addition to keeping yourself healthy, I believe you have an obligation to try to reduce the risk of other people too. You can be 2 days away from even having a symptom and be a carrier to somebody else. I did. Oh, no, I just got a comment from somebody. Let me make sure. Are you seeing my screen? Are you seeing the slides? Can somebody send that in? I got a yes. Okay. Thanks, Kelly. Is there somebody there that's not seeing my screen? Anita, you're saying you're not seeing my screen. I don't know why. Are there other people not seeing the screen? Not anymore. Okay. Can you see the screen now? Anita, can you see the screen now? Can't see the slides. How about now? Anybody still not seeing the slides? I have no screen. Okay, I'm going to try this. Now, can you see me and the slide? That's what they, oh, yes, I got a yes. And yes. Okay. All right, thanks a lot. Thanks for letting me know. So we talk about flattening the curve. What do we really mean by that? It's really simply, we want to reduce the number that will get sick within a certain time period. See, one of the things is that if the same number of people got sick, but it happened over a number of months, the doctors would be able to handle it. The equipment would be adequate. But, honestly, if you need some serious attention and they don't have the proper equipment or enough staff, it's going to be bad. It's going to be bad. So what we want to do is try to keep as many people healthy for as long as we can keep them healthy. Now, a concept I want to talk to and why I titled this the way that I did is I think it is kind of giving some false comfort, I'll say, to be thinking, well, when this is over, like when this is over, everything will go back to normal. When this is over, I have nothing more to worry about, danger's past. In a very real way, it's never over. We're always fighting bacteria and virus. Virus and bacteria are always mutating. It's an ongoing thing. And so what I want to do is present an idea that says, yeah, absolutely, we need to do everything we can immediately in this situation. But a lot of those things are the same things that you would do in the long run. And I want us to think more in the long run. I want us to be thinking, okay, what if there is a second wave? What if there's a new virus? We have been having virus and bacteria attacking us all the time. And for most of us, we don't even know it, or we know it sometimes. We feel it a little bit. But I really think this is a great opportunity to look and say, hey, this is something that can happen. What can I be doing in the long run to be affecting myself, affecting my family? We don't have to be sitting ducks, waiting for something else to come along. So there's a lot of overlap between what we would do right now and what we really ought to be doing all the time. Another thought. Will the vaccine be an answer to all our prayers? Well, the short answer is no. First of all the experts say it's going to take at least a year to come up with a vaccine. Second of all, like all vaccines, they're designed for a virus that's in a particular form. And this virus, like all the other ones, is going to keep mutating. Thirdly, if a vaccine does have any efficacy, it has it for a pretty, I'm going to say, not the biggest part of the population. And fourthly, if a vaccine does have some positive effect, even for 40, 50, 60% of the population, its effect is very short term. It is not something that gives us long-term protection in any way. So what I want to promote is, sure, let's do things in the short run. Let's help with what we can do right now. But what can we do that would be something we could keep? Something that would be a permanent enhancement to our immune system. Here's another one of those thoughts going on out there. Is it better to just get the virus, beat it, and move on? Well, in a way, yes. If your immune system is strong enough to make sure that this doesn't do you any major harm, yeah. But if not, then no, I wouldn't say so. Let's not go at it that way. But in a way, what does happen is that once a virus enters our body and our body fights it and beats it, it has made its own antibodies to fight that, and you do have an enhanced immunity to that particular virus. So different from when you get a vaccine. Our immune system works on two levels. There are what are called B cells and there are what are called T cells. What happens is you need both of those to have long-term immunity. The problem is a vaccine only stimulates B cells. It doesn't stimulate T cells, and T cells are the ones that would give you a long-term immunity. This thing keeps changing a little bit on me. So right now, what happens if you go to the doctor and you have COVID-19? Well, really not too much. Particularly in our area, and actually in most places in the United States, there aren't enough test kits to test everyone. So I know in our area, healthcare workers are being tested and people that have very serious symptoms are being tested. Not very many other people are. So unless you're seriously ill, a doctor's pretty much going to send you home. And so there really isn't like treatment. There are things to make you more comfortable, but not much that is really done. The ventilators are held off for people that really, really need them, and that really makes sense because especially since there's such a shortage of them. So who should go to the hospital? Pretty much the rule is if you're having significant shortness of breath, you should go to the hospital, mostly because this tends to attack the lungs and they want to make sure that you're not getting into a danger zone. So the statistics are that about 10% of people who get COVID-19 need to go to the hospital. And of those, about 1 to 3% of those will require actually being admitted to the ICU and need a ventilator. So the percentages are low. It's just that, again, keep in mind, hospitals were pretty full before this. And this isn't instead of the flu. This is on top of the flu. This is on top of gallbladder problems, auto accidents, any other reason that somebody might end up going to the hospital. So what we hear a lot, what I hear on TV that kind of makes me crazy is they say, you know, social distancing is our only tool. That's what we have. It's really not true. Social distancing is really important. And I don't mean to discount that. But it's certainly not our only tool. It's a good tool and we should be following it, but it's not the only tool. It mostly has an impact on spreading, but it's not enough. And that's why schools are closed and that's why we're washing our hands. But even more important, it's not enough because it doesn't make us healthier. It helps us to not spread it, but it doesn't do anything to make us more healthy than we were before. It doesn't make us more prepared to handle the next thing that comes along either. So hearing all this, I still say, this isn't a time to live in fear. This isn't a time to panic. But it is a time to be aware, be mindful, and do things that you can be doing to protect yourself. Most of the statistics show that if we do that, we're going to come through this pretty well. So, but it's a time to reevaluate yourself. It's a perfect time. You know, I think of how people, you know, around right after New Year's, people make all these New Year's resolutions. You know, well, thinking back into last year, you know I could do this better, or I really want to do this. This is another one of those times. And so I want to invite you into that. And that's really why this talk was designed. And I've tried to purposely focus on things that don't cost any money. Yeah, there are a lot of really good supplements, and I spent a fair amount of time on the last webinar with that, and I'll bring up a short list, but that's just not what I want to focus on right now. But the crisis is happening now. And do I think you should be taking supplements? Yeah, I do. But I also think there are a lot of things that we can do that don't cost any money. And so what I'm trying to do is provide something that says, okay, not going to cost you money. You've got a lot of extra time now. No more excuses. First, I want to start out and say, this is on a emotional level for our health. Accept reality. It doesn't do any good to try to live your life for when this is over. It doesn't do you any good to be worrying about who's going to get this or when am I going to get it or what's going to happen or anything like that. Just make sure. Okay. It makes sense to make your day-to-day activities pleasant. It makes sense to take time to do things that when you didn't have this kind of relaxed schedule that you said, ah, I wish I had time to do XYZ, whatever it is. Look for ways to take advantage of it right now. So I want to invite you to do that. There's kind of a rule of thumb in terms of accepting reality. You know how you tell if something's supposed to be happening? Because people think this shouldn't be happening. The fact is, it is happening. But you know how you tell if something's supposed to be happening? It's happening. That's how you know it's supposed to be. So let's look for positive ways that we can make some use of this time. First thing, get outside. Most of us live in an area that we can still have social distancing and get outside. We can get a little sunshine on those days that the sun is out. We can get some fresh air, get those lungs going. When you're out there, take some deep breaths. Breathe in deeply and bring in the fresh air. We have a lot of that up here, much more so than in cities and towns where pollution is so high. Vitamin D is really important. It doesn't get the respect it deserves, but it's particularly important for flu-like symptoms, and it's particularly important to prevent the flu. So it's an easy blood test. If you decide you're going to go that way, optimal levels are between 60 and 80, but take some vitamin D. And I'm saying that right now because even on sunny days where we live, you just don't get that much vitamin D for a little while longer. 45th parallel just kind of blocks some of that. Exercise. So many studies, all the benefits that you know about exercise. One of them is it enhances the immune system. I can't overemphasize this, how important it is. And that can be your walk where you're outside, you're getting some sun and you get some exercise all at the same time. If you have dogs, your dog would love it. This is something you can start now, and my hope is, because we've all got this extra time, my hope is that you'll cultivate a habit. Because we're really looking for, not only should you do right now, but what can you do in the long run for whatever comes anytime later in your life. This is another big one that I think is really important. Get warm enough to sweat. Many studies show that raising core temperature in our body kills virus. If you have a sauna or you have access to a sauna, this is a really good time to be using that on a regular basis. If you don't have a sauna, there are many ways to raise your core temperature, and sweating is a good indication. We have a short video on our website at sacswellnesscenter.com that gives several ideas for how to achieve the same benefits of a sauna without having a sauna. So we've set up a tab on the homepage of our website that is entitled COVID-19 updates, I think it is. So look in there. The Chinese have been able to find out that high temperatures, this virus is very sensitive to high temperatures, so it's a good way to kill them off. Keep this in mind because people get freaked out when they get a fever, but you know, a fever is what the body is using to try to kill virus. That's why you get a fever. So yeah, it's important to make sure the fever doesn't get out of hand because, I mean, realistically, I mean, basically you can fry your brain, but a fever is actually a good thing that your body is working. So steam baths, saunas, physical movement, induced sweating, really good thing to be doing. As an aside here, a couple of things about what you might do, what I am advising you not to do, or what I'm sharing is coming from both the French Health Ministry as well as the Lancet, one of the medical, very respected publications, are saying that particularly ibuprofen is something that we should not be using while this is going on. Ibuprofen has an effect of, it affects an enzyme that makes it so that the coronavirus has an easier time getting inside the cell. So in our government, they're recommending that we use acetaminophen if need be, rather than ibuprofen. The French industry is saying don't use either, and find other ways. But in the meantime, it is a known fact that the fever is actually a good thing as long as it doesn't get too high. Quercetin is a nutrient known to be a very powerful viral stopper. So yes, there are supplements for quercetin, and therapeutically, they're using between 500 and 1,000 in therapeutic doses, but for preventive kind of use, we should be able to get quite a bit from the food we eat if we eat the right foods. So a diet that's very high in vegetables and some fruits, but this is a natural viral killer. Let me see, I think I put in a slide. Yeah, these are foods that are particularly high in quercetin: onions, berries, red leaf lettuce, figs, buckwheat, and apples. Okay. But if you feel like you're getting symptoms and this is something you want to get, most health food stores would have quercetin. 500 to 1,000 milligrams would be very helpful. This is just more an NSAID. So just keep in mind, fever is something your immune system works with. It's something it produces on purpose. It's not a bad thing unless it's excessive. People with high blood pressure may be in increased risk. That's why they're talking about cardiovascular. One of the reasons cardiovascular is an issue. And the reason for that is that a very common blood pressure medication is an ACE2 inhibitor. And ACE2 receptors are blocked when we use this type of a blood pressure medication. That happens to be the same thing that ibuprofen is doing, in the sense that that is the same receptor that COVID uses. So it will hijack the receptor and it'll get inside your cell much easier. So I'm just sharing that if anybody you know or you are on a ACE inhibitor, this might be a time to see if a different blood pressure medication might be more effective for you. So let's think about this. If you did get seriously ill, or someone you knew got seriously ill, if you need to be in a hospital, if you need to be on a ventilator, by that time, it's too late to be thinking about doing exercise. It's too late to be thinking about avoiding sugar and taking supplements. So I'm bringing this up because now is when you can do something about this. Now is when you can do something to make sure that you don't end up in that situation. Now is when you can share that thought with other people and really cultivate the kind of habits. And I know for most of you that are on this webinar, you're already doing a lot of things, but I bet you could come up with one or two things that you could say, I could do a little better with that. I could improve something that I've been kind of letting go and just feeling like, I'm doing okay. It's all right. Well, now's the time. So I want to bring this up one more time. I brought it up in the last webinar, but I really think this is something that's really key. So much of our lives, the way that things are promoted on TV, the way we hear things when we go to our family practitioner, is aimed in a totally different way of thinking of things, and it's insidious. It gets inside of our thought processes and we forget. And Dr. Virchow is considered the father of modern pathology, so the father of disease. And what he said was, if I could live my life over again, I would devote it to proving that germs seek their natural habitat. They look for a place that is the kind of place that they can live. And that kind of place is diseased tissue. And what that means is any tissue that is not healthy, any tissue that isn't as strong as it could be. It looks for that rather than it being the cause of making that tissue diseased in the first place. So what I want to emphasize here is, if you've worked with us, if you've worked with Teresa or myself, maybe even on your own, you know that we're constantly looking for those areas of your body that aren't as healthy as other parts of the body and they need to be strengthened. And what Dr. Virchow is saying is, the healthier your tissues are, the healthier every cell in your body. Right now, let's even talk about the lungs. The healthier your lung cells are, the less a germ, whether that be a bacteria or a virus, even a fungus, the less it is able to find a habitat, the less it is able to find a place to set up camp and get in there. The way a virus works, it attaches onto a cell and then it finds a way in. Once it gets in, it starts being able to replicate. It starts using our own RNA and it will be able to multiply. If it can't get in, can't do anything. So keep that in mind when we might say, well, I'm finding certain parts of you that are weak, and you say, oh, Yeah, but that's not why I thought I was coming here. Yeah, it is why you were coming here. Because what we need to do is make all the cells in your body so there isn't a place for these things to settle in. Keeping cells strong. That's the whole key to health. So to summarize things, know where your hands are and where they've been. Sanitize them, wash them for 20 seconds, keep them away from your face. Consider wearing a mask when you're not at home. Consider wearing a mask when you are at home if somebody in your home has symptoms, or if you've been exposed to somebody that has symptoms. Keep 5 or 6 feet away from people. Get some fresh air. Sweat. And the one we haven't talked about yet is practice restricted time eating. So what restricted time eating is that you limit the amount of time that you're consuming food. So 10 hours or less is what's recommended. 6 or 8 is even better, actually considerably better. Again, something that has been proven to enhance our immune systems. So, what a lot of people do is say, okay, if I don't eat breakfast and I eat lunch around noon or 1, and I eat dinner around 6 or 7, then what you have is a lot of hours that your body can devote to just making cells stronger, making your digestion easier, helping out in every way. It makes more enzymes. It makes more hormones. It's really an incredibly powerful thing to do. The kinds of things that happen to people when they do that after about 30 to 60 days, the stories are incredible. So, something I really strongly recommend. So I said I would mention, these are supplements that we consider to be kind of the basic to try to keep yourself healthy. This is for people that you don't have symptoms yet, but maybe you think back and you say, well, I have been eating too much sugar. Well, I haven't been exercising. Well, maybe my immune system isn't as strong. I've been getting colds 2 or 3 times a year. This is a good place to start. I believe, according to this platform, everybody's supposed to get a recording of this, but what I can promise you is that the recording will be on our website. Give me a day or so to get it on there. If you want your own copy, email me and I'll make sure that you get one sent to you. So I didn't want you to have to scramble to try to write all this down. So, and then there is the acute challenge, and this is what you do if you start to get symptoms. So it's a little bit different recipe. There's a minimum you really need to do if something acute starts happening, and that's the column on the left. If you can do the comprehensive, that's even better. Then when it's all done is when you need to regenerate after you're past the acute stage. So that's when whatever's been destroyed because you were fighting something, don't be one of those people that thinks because the symptoms are gone, my body is 100% now. No, the symptoms are gone. That's great, but that's not health. That's not healthy like you can be. Another thing I want to introduce is don't let the perfect be the enemy of the good. So I presented a number of things. Some of them you may be ready to start doing. Some of them you may not. Some of the supplements you may be ready to start taking. Some of them not. Some of the supplements may be out of stock. We are working hard to try to keep everything in because The manufacturers are having trouble keeping everything in stock too. But do what you can. Take steps. Do what you're willing to do and maybe a little bit more than that. Don't let the fact that you can't do it all stopping you from what you can do. This is a good time to take stock and say, what should I do? What's the step I can take? So on our website, we have posted the previous webinar. We'll be putting this one on there too. We have a YouTube on how to keep your groceries and any other food, like if you get delivery or carry out, really good practices on how to make sure that that is safe, because that's something foreign coming into your home that other people have been exposed to. There's a video by a doctor who's in New York, who's at one of the busiest hospitals in New York. So his hospital has pretty much turned into a COVID-19 hospital. And he was asked by family members in other parts of the country to kind of tell him what's going on, tell him what he knows, tell him what should be going on for them. And I just think he did a wonderful job of both explaining what to do, that pretty much if you do what's on there, actually if you do what's on here, the likelihood of you getting COVID-19 is incredibly minute. But you can hear it firsthand from somebody that is dealing with people on a daily basis at a level I think most of us couldn't even imagine. So the other thing that's on our website is a short video on how to heat up your body without having a sauna yourself, and that's at sacswellnesscenter.com. Little bit of an update for us. Right now we are open Monday, Wednesday, and Thursday. We're doing chiropractic care for people that are in pain or have an increased pain, or something has happened, but not for maintenance care. We're trying to minimize contact, but also help people to not be in pain. We are offering chiropractic care to all first responders and healthcare workers at no cost to them. If you know somebody, feel free to share that information. We have protocols in place for how we can do that, and keep ourselves safe at the same time. Call us if you need us. We have protocols in place for you. Nutritional therapy is being done by telecare. That's another thing. You'd have to call and make an appointment. If you need supplements, you can call us with that in advance. We're not taking any walk-in services, but if you call us, we will get everything ready, and then when you get here, we'll bring it out to your car for you. We're hoping that we'll be able to reopen April 14th, but it kind of depends on what the governor says. There hasn't been an update that I'm aware of on that, but looking at the numbers, I can't imagine that it's not going to be extended longer, but we'll work with what we're supposed to do and probably still keep our protective measures and protocols in place for quite some time, I would think. So I want to say to everybody, thanks for taking the time to be on this. Be safe, be well, and think of being healthier in the long run. Think of building your cells and making yourself stronger. And be ready for whatever comes along. So I can answer some questions if anybody has anything they want to say. I hope I'll see it. All right, so I'm not seeing a chat or a question right now. So, in case something went wrong and you're unable to or unable to see it, then send me an email. Dr. Saks, DRSAKS at sakswellnesscenter.com, and I will get back to you. Thanks a lot, everybody, and stay safe and stay well.